oxaliplatin. Now, is there value in reintroducing oxaliplatin? I doubt it, and I will say that it's unclear based on this. Why is that? Reintroduction was only possible in 30% of the patients, and the median number of cycles after reintroducing oxaliplatin was less than 4. So I would say that reintroducing oxaliplatin likely will have very little impact in the disease in these patients. And also very importantly, those patients where they reintroduce oxaliplatin, the rate of grade 3/4 neurotoxicity doubled compared to the group of patients that received those 6 months and then stopped. And this may have an impact in our ability to treat these patients in second line, because most of us will use Gemabraxine in the second line in these patients as long as they don't have neurotoxicity that preclude using Abraxane. Now, the last part of my presentation is going to be on gastric cancer. As you know, there's a couple of, actually 3 target therapies approved for gastric cancer now. The first one that was approved, trastuzumab, based on this trial on the top, showing improvement in survival when trastuzumab was added to a doublet of chemotherapy with cisplatin and 5-FU. Now, the rest of the trials that have been completed, unfortunately, have provided very disappointing results. You can see small tyrosine kinase inhibitors, negative data, combination of Herceptin with anti-HER2, HER3 also not showing improvement in outcomes, and the same with antibody-drug conjugates. Now, at ASCO this year, there was a presentation of this phase 1 trial. This was an antibody-drug conjugate that, as you know, has an antibody directed against HER2, which is the target in a number of these patients with metastatic gastric cancer. And this antibody is bound to a cytotoxic. Now, what are the attributes of an optimal antibody-drug conjugate? So we want to have an antibody-drug conjugate that it's stable, that the payload is not cleaved from the antibody in the blood, because that will lead to off-target toxicities. We also need to have a target, HER2, which is only expressed by cancer cells and not by normal tissue, so that we don't have, again, off-target toxicities. And ideally, we want to have a drug that has activity against those HER2-positive cancer cells, but also has a bystander effect, meaning those cells that are nearby that may or not necessarily express HER2 because of tumor heterogeneity will also be affected by this compound because of bystander effect. So this drug that was presented, as I said, this was a phase 1 trial, so included HER2-positive patients, breast cancer patients, gastric cancer patients, colorectal with HER2, lung with HER2. But look at this plot on the left bottom corner. So HER2-positive gastric cancer, this is a beautiful plot. Response rate, 44%, which actually is pretty much along the same lines of what the TOGA trial showed with chemotherapy plus Herceptin in the first line. And these are patients that have already been, and these study patients that have already been treated. So I think that this is very encouraging data, and there's a study ongoing already in Asia with this molecule, specifically for patients with HER2-positive gastric cancer. We'll see if the data holds when we go to later stage of development, but it's definitely promising. So what is the summary of ASCO? Great year, as I said, for pancreatic cancer. New standard of care for fit patients who, after resection, are able to receive FOLFIRINOX. And remember, this is a toxic regimen, so we need to use attenuated schedules of FOLFIRINOX, no bolus 5-FU, and decreasing the dose of irinotecan. Definitely neoadjuvant treatment, the setting of resectable or borderline resectable disease are the way to go for a number of reasons. If you look at the CONCO-1 trial in pancreatic cancer, that trial randomized patients to surgery versus after surgery to single agent gemcitabine versus observation. 60% of the patients relapse within 4-6 months. So this is a systemic disease. You want to be able to expose these patients to systemic chemotherapy up front, treat micromyclonus showed this picture last year, so some of you may say this guy's showing again the same picture, but just to say I miss my hometown. So.